Good afternoon, and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communications for the City of Waco. And we're on our 20th consecutive weekly press conference originating from the City Hall. And we have some new guests with us today. But let me outline, first of all, a little bit what we're doing. First of all, downstairs in our studio, we have an American Sign Language interpreter providing information for those people who need those services. And we always have a Spanish version being recorded audibly down there as well. And this afternoon at 4:30, we'll be airing a complete version of this press conference, all the words, everything, questions and answers in Spanish. And always so gracious to be with us to make sure our Spanish speakers get the proper invitation and knowledge about this press conference is our District 2 Council Member Hector Sabito. Hector, thank you for that. Would you invite the Spanish speakers to watch our video this afternoon at 4:30?
Absolutely. Thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you so much. It's always a pleasure.
Thank you for being a part of our regular conference that we have here. Well, joining me today, in addition to our host, our mayor, Kyle Deaver, we have some new guests with us. First of all, we have Dr. Jerry Mays, who is the Executive Director of the Education Service Center Region 12. We also have Dr. Kelly Reynolds, who is the Chief Medical Officer for the Family Health Center. We have Dr. Morrison, who's the Chief Medical Officer for Baylor Scott and White. And we have Dr. Brian Becker, who is Chief Medical Officer for Ascension Providence. Thank you for you all being a part of our panel. And what we will do, outline how we'll proceed. We're going to ask each of you to make an opening comment, anything that you've been thinking of or that hearing about the community in your area of expertise. And then I'll go down the questions that I've assembled here for us to talk about. And then following that, we have two media representatives on the phone from various local media outlets. And then following that, we'll let you all have a closing comment. So we'll get going. And let's start our opening comments today with Dr. Reynolds.
All right. Good afternoon, everyone. Thank you for letting me join this group. I'm so proud of the group of folks here working to keep our community informed and working together to keep our community safe and strong. I really appreciate that. I want to start with an update on some reported cases of COVID or coronavirus infection. Worldwide, we have 22 million cases reported with over 780,000 deaths. In the United States, we have 5.4 million cases and over 171,000 deaths. There were 44,000 new cases reported yesterday in the U.S. And last week, the 7-day average was about 51,000 new cases, which shows a continuing decline, which is good. Shifting to state numbers, the State Department the Texas Department of State Health Services reports 550,000 cases in Texas total so far, with just over 10,000 deaths. And the state daily cases, new cases, had been decreasing. There's a slight rise just for the past few days, and hospitalizations are still on the downslope. The positivity rate in Texas is 11%, which is down from a spike in the positivity last week, but back more to the baseline the end of July. So it seems to be kind of returning to that to that baseline. For McLennan County, the McLennan County update this afternoon, we have 5,595 cases of coronavirus and 111 new cases since yesterday. 71 of those are reported from the community testing done at MCC. And we have 53 patients hospitalized with COVID-19. 16 are on the ventilator. and we have 75 deaths reported as of yesterday afternoon. Total tests completed in Clinton County, 41,954. And one of the stats Dr. Griggs has been sharing with us is the RT, or effective reproductive number. And this test is calculated or a statistic is calculated by the UT Public School of Health. And from a Clinton County, it's 0.88, which is good. It's still below the 1.0 and shows that we are slowing the rate of viral spread. In the nursing homes, we have 8 current facilities with an outbreak, which is defined as 1 or more residents or staff testing positive for coronavirus. And at this point, still 265 nursing home associated cases. And in the county jail, we have 29 cases among staff and inmates. And finally, just a quick update on Family Health Center. We continue to evaluate patients for possible COVID out in settings outside our usual clinic settings, either in cars or under tents, trying to keep our clinic settings as safe as possible. And so far, we've done just over 7,400 tests. And that is all my comments.
Okay. Dr. Morrison from Baylor Scott and White. Dr. Morrison.
Thank you, Larry, and good afternoon. As always, very happy to serve with a great group of city and county leaders and our healthcare community, public health district, in a great collaborative effort to combat COVID-19 in our community. I will tell you at Baylor Scott and White this week, we continue to be very busy. Between 10 and 15% of our licensed beds have been typically filled with COVID patients. Between a third to a half of my typical ICU capacity has been filled with COVID patients. So that displaces a lot of the other work that typically happens in this building. We are not delaying any urgent or emergent care at this point, but some routine care and some necessary care is being delayed in our community still because of the impact of COVID. But we still have capacity. We're prepared to meet this challenge, but the challenge remains.
Okay. Dr. Becker from Ascension, Providence.
Thank you, Larry. I'd like to start by thanking again Mayor Deaver and his team for providing a comprehensive and coordinated approach during this pandemic. I'm grateful to be a part of this collaborative effort, and again, a pleasure to be here this afternoon. As Dr. Morrison pointed out, our volumes are similar. We have approximately a third to half of our ICU capacity is spent managing COVID patients, and 10 to 15% of our inpatient volume is also COVID related at this point. We continue to monitor viral activity in the community, and happy to say that we've seen some reduction, approximately a 25% reduction in hospitalized COVID patients over the last 2 weeks. So that's nice to see that we're headed in the right direction. It seems to be trending appropriately. In the past week, we have relaxed a bit our visitor policy at Ascension Providence. So we are now allowing 1 visitor per patient, and that's a bit of a change. We are still focused on patient safety and the safety of our visitors. So we continue to screen those visitors upon entry, making sure that it's safe and appropriate for them to enter the facility. I think it's important for us to think ahead, and as we move into the cold and flu season, we're beginning to prepare for what does that influx of patients look like, both in our clinic setting and in our hospital setting, and encouraging folks to receive a flu vaccine as early as we can get them. Prevention's key. So again, I think it's important to continue to wear masks, socially distance, wash hands. So again, thank you for having us here this afternoon.
Thank you. Dr. Jerry Mays with the Education Service Center, Region 12.
Thank you, Larry. And I'll echo Dr. Becker's comment, just congratulating and thanking Mayor Deaver and the team for a collaborative effort that continues to make us all proud. Waco does what it does when it's time to pull together and to work together to solve difficult problems. Yet again, our leadership's rising to the top. As an education service center, I'll say a couple of things. You may not know what an education service center does. Well, for the last 50 years or so across the state of Texas, service centers provide the training, technical support, pretty much anything that a school district needs for their operational ability. We provide the training or the supports for that. It's a function of the legislature. We work directly underneath the Commissioner of Education. And our big picture concept is that we roll out statewide initiatives and promote student achievement and help school districts save money. All in all, we're a one-stop shop. So that's the reason we're involved now in this and this time of pandemic and trying to redesign the way education works in Texas. Here in the Region 12 area, we serve not only McLennan County, but the 12 contiguous counties. And during this time of trying to redesign, we're at the front of not only what local districts need, but how to get statewide initiatives, the statewide emphasis on, for example, how to develop remote learning, that sort of thing. Because what we're finding is what we found back in March. It's very difficult to go from the way we've known school to the way that school has to be in order to keep students, parents, and staff as safe as absolutely possible. So that's Region 12. It's why I'm pleased to be here today, pleased to be a member of the Waco community and this team, and look forward to answering any questions you might have.
Very good. Mayor Deaver.
Thank you, Larry. Thanks to all of you for joining us as panelists today on this press conference, and appreciate everybody that's tuning in to get the latest on what's going on with our fight against to contain COVID-19 coronavirus here in Waco and McLennan County. I want to bring up a few slides, as I usually do, to kind of update you and share a little more information. Some of this Dr. Reynolds has gone over, but I'll show it graphically. We have, this is the slide that we always show that is our cumulative cases to date. We passed 5,400 cases as of the beginning of this week. Our rate is slowing. We had passed 5,000 as of last week. And you can see from this next slide, we are continuing to decline. The blue bars represent new cases each day, and then the red line is the 7-day average of that. And you can see that it is continuing to decline. That is a good thing. We are now at below 50 cases per day on a 7-day rolling average. At our peak in July, the average was over 150. But we still need to follow the physical distancing, hand washing, and face covering measures to drive this number lower. We have a large number of cases that are pending from the community testing that was done last week at MCC. It seems that most of those individuals were tested, got their results very quickly, but the lab has not reported all those results to the health district yet. I understand we started receiving those today, and so they should be processed over the next 2 or 3 days. Hospitalization, as Dr. Becker and Dr. Morrison mentioned, we are doing much better. We're down near 50 in terms of average number of hospital patients that are hospitalized. That's a good thing. The concerning thing is that we're still seeing as many patients on ventilators as we saw at the peak. It's very, very near the peak. And so as was mentioned last week, we have fewer patients in the hospital, but a higher percentage of those are requiring ventilators. As of last week, we had experienced 3 weeks in a row of record high fatalities. Last week, the number of fatalities dropped from 16 to 8 this coming week, or this past week. Hopefully that trend will continue down. We've had 3 fatalities so far this week as of yesterday. This week, we saw a dramatic reduction in the positivity rate for the state of Texas, as Dr. Reynolds mentioned. The 7-day rolling average went down from slightly above 19% to just over 14%. There is a little bit of question in the validity of some of these numbers because the state changed its server for handling the reporting of testing. And we understand that there were 2 days in which there were large data dumps of backlogged cases. And we understand that many of those test results were from several weeks ago, which could mean that they were administered at a time when the prevalence of the virus in our state was not as high as it has been in the last week. For that reason, Dr. Werner suggested that we also take a look at the 14-day rolling average to see what that looks like, to smooth out some of those data hiccups. And you can see that on a 14-day rolling average, we are at 17%. It's still a decline from the peak. And hopefully those data issues will work themselves out over the next week or so, and we'll have a clearer picture of where we are statewide this time next week. Our McLennan County positivity rate continues to move down. That's a very good thing. We are down to 11.8%. I don't believe this slide has the most current data. This is last week's slide, which we were at 13.1%. We're now down to 11.8% on a 7-day rolling average. Remember that Governor Abbott and the CDC have said we need to be below 10% and preferably around 5% to feel like we are adequately controlling this pandemic. As I mentioned, we've got a lot of outstanding tests still from the MCC testing that could affect this. Tests have been conducted, but we haven't gotten the results back yet. We've also got a large number of tests that Baylor has conducted and that other universities have conducted before having students and faculty return to campus. Those have largely been done, in the case of Baylor, certainly have been done by a mail-in kit. So each student and faculty member was mailed a kit where they did their own swab and sent them in for testing. And Dr. Livingstone reports that those tests are coming back a little under 1% positive, which is really a good thing, and it will affect our positivity rate. But that causes some question about the data. And so I've also looked at this on a 14-day rolling average. We don't know yet whether we have received those test results from the labs that have been doing the testing on the students. And but our rate continues to look good. We've just got a lot of things coming up with reopenings of schools and the upcoming Labor Day weekend. We've got to continue to be vigilant and do what we know we need to do to keep ahead of this virus. So that's all for now. I'll turn it over to Larry to get into the questions. Thank you.
Okay, thank you, Mayor. Well, Dr. Mays, you get the first couple of questions because when people heard that you were going to be a part of our press conference, school starting, I think there's some good questions here. The opening of schools this year has been a real challenge for area districts, with each having their own needs based on resources, size, and other things. What seems to be the most common challenge throughout all the districts that are impacting holding in-person classes?
Yeah, Larry, all schools are managing the same set of issues because of the nature of the virus, but in different settings with so many different, wide variety of resources and opportunities. The biggest challenge that everyone faces is what happens when you bring people back together. Well, our health colleagues and friends know, and we know from experience now, that as schools have begun to start and bring people together, once we get them into closer environments, the spread increases. And therein lies the challenge. Schools are doing a great job of following the guidance and processes that we know about distancing, sanitation, using small groups, how to create alternate schedules, in every way create school in an environment that can do its very best to keep children and staff and thereby our community safe. And but across the 85 or so schools that we serve here in the Region 12 area, we're finding a very wide variety of outcomes. Some schools, smaller schools, seem to have a better opportunity to spread children out and staff out and keep spread down. The larger the group, the more challenging that becomes. But again, I think the common challenge is just how to minimize the threat.
Okay, you pretty well covered the second question I had, was dealing with precautions and stuff, but how prepared do you think the schools are to handle any COVID-19 cases or potential outbreaks like ones we've seen across other states?
Well, to kind of extend on what I said earlier, every school has a plan. And depending on their local area, their local health authority guidance, CDC, TEA, and all the things that come to bear, each school district has the opportunity to create their own plan for how to manage this as cases arrive in a school. And I would just say this in the spirit of all honesty: every school can expect to have cases this year. And that's unfortunate, but that's just the reality of the way it will work. So there will be starts and stops to schools as cases rise on a campus. The standard plan calls for a 5-day closure, quarantine of the people that were affected, proper tracing, all the things that that you and probably know that our communities have heard about. But then you get them back into school and restart the process. So schools are very prepared. For the last ever since March, we've been working on this very question: how to get back to school safely, knowing that when we come back to school, because of the nature of bringing large groups together, and school by its nature is a large group activity, and we're trying to make that a small school activity now, and create more remote learning opportunities, and do the things that can maximize student outcomes while at the same time creating some community safety. So I'm very, what I see across all schools makes me proud of the leadership there in the schools with their local communities, their boards, et cetera.
Okay. We're hearing reports that Hewitt and Woodway police departments are not enforcing mask requirements enacted by the governor. Can anyone clarify what exactly the requirement is, as your understanding, maybe statewide?
I'll take that, Larry. Governor Abbott has indicated that he expects local municipalities to enforce his orders. He's also said that he would not be inclined to give any additional local control to municipalities that are not enforcing his orders. So Waco is enforcing the governor's orders, and each municipality has to decide for itself through its council and staff whether to enforce the orders. From a public health standpoint, it would be best if all municipalities were enforcing, because as we know, with any public health situation, the virus doesn't recognize any city limits.
Okay. The new saliva direct testing regime was approved by the FDA over the weekend. How soon can we expect those tests to be available in McLennan County?
I'm sorry, Dr. Reynolds, can you take that?
Sorry, left it on mute. Yes, this is a really interesting test developed by the Yale Public School of Health, an open source protocol instead of an actual kit that they've developed, but an open source protocol that high complexity laboratories can use if they have the appropriate instrument. It's going to be easy to do. There's no swab involved. You just have to collect some saliva, so less interaction with healthcare staff having to do the actual test, and it should be cheap. Unfortunately, I don't know how long it will take for local laboratories to implement this protocol and kind of figure out how to do this and bring this to Waco and McLennan County. So I don't have an actual answer on how quickly we would get that. We're certainly looking into that. I'm sure all the local laboratories will be looking into that. I don't know if the folks from the hospitals have any more definite timeline answer for that or not. Nope. We'll always be looking at it. Thank you.
No, I'm not aware of a timeline for us at Ascension Providence to be able to offer this test. It certainly does afford people an easier point of access to get testing done, and hopeful to see it soon.
Okay, one for Dr. Mays. How do you think the impact on how children will be educated during the pandemic, like virtual, in-person, or the blended processes, how will that affect the progress in future years of their education?
Dr. Mays, you're muted.
Thank you. Unfortunately, children have not been in the regular school setting since March. So it's very believable to think that there is academic regression, but it's also very manageable. I appreciate the work out there in the school districts and even at the state level. Commissioner Morath last week revealed a plan for allowing every school district to have a learning management system, which becomes the platform for how to deliver your remote learning. Well, with that system itself, then the way curriculum and instruction gets delivered improves dramatically. So that's part of what we're working on here at the local level, is to how to get that learning and ability disseminated. There's also a the state is managing the Project Connectivity Plan, which is the use of some of the federal stimulus money to make sure that every child has a mobile device, some way to receive remote learning when that becomes necessary. Let's say if a campus has to close down for that 5-day period or longer, whatever it is. Because unfortunately, children with less advantages in that area suffer the greatest academic consequence. So there's I would say that there is a major effort out there to remediate academic regression and to create an equitable opportunity and a reasonable opportunity to be educated, whether it's face-to-face in the building or during those remote times. But there will be there's already academic regression, but schools are very good at remediating that. We are becoming very good at remote learning, and we'll get much better. And I think as we go through the year, there will certainly be times when everyone in the community will feel some level of frustration about what we have. And, you know, the nature of education, the wonderful part is that it affects everyone. Everyone in the community has a stake. So everyone will also, and it is now, everyone is working toward trying to make sure children suffer very little academic, social, cultural regression, whatever it is, whatever they're looking to the schoolhouse for. And then we improve student outcomes as the year progresses.
Okay. Is the Waco Police Department planning to address off-campus parties at Baylor to help avoid COVID spreading events?
Well, we certainly hope that our returning students will be socially responsible and abide by the state and local emergency orders. We've seen around the state and the nation different pictures of parties that have been happening, and those obviously are huge risk factors for our community. If our police department receives a complaint, they will certainly investigate for violations of the order.
Okay. Will there be more public testing sites, kind of like what we had this past week?
Yes, those testing events were extremely successful, and we're really grateful to the Emergency Operations Center, the Texas Department of Emergency Management, and the Waco Clinton County Health District for putting those together, along with the partners who hosted those sites for testing. The EOC is currently working on scheduling future testing and working with the state and with our partners in the health district to coordinate those dates. Don't have anything to announce yet, but there will be more testing coming.
Okay. In the lower grades like pre-K and kindergarten, where kids typically need more early, personal, loving care from their teacher, how will teachers be able to instill the love of school and learning when having to teach virtually or limiting contact while observing social distancing?
Larry, I'll take that one. That's that's one of the great concerns. And but what we find is, as schools have developed their plans for how to get children back in school, there's certainly a recognition of those early childhood needs. Where our little guys they need us personally and interpersonally. And so as resources are applied, whether those are space resources or whatever it takes to get children back in school, across the board, those efforts are to get small children back into the interpersonal environment more quickly than the older, because naturally, as children become older, they become more capable of managing virtual settings and just able to do those sort of things. So that's a great concern, and I'm happy for that question because it points up a very important need out there that our little guys need us most of all. And the schoolhouse, I'm confident, and looking at the plans across the region and across the state, they're applying those resources there first. But that's exactly what needs to happen. So thank you for that.
Okay. When will bars be able to reopen? And that's not for you, Dr.
I'll
Mays.
speak to that. Okay, got it. The city's order on bars follows the governor's order on matters like this. The governor recently issued some guidance and said that in order for him to consider reopening bars, he would need to see the state's positivity rate below 10% for a sustained period of time. And he would also need to see hospitalizations decrease. So at the point that the governor makes it an option for bars to reopen, the city would do the same.
Okay. With colleges and schools back in session, do you expect numbers to go up?
Dr. Becker, would you mind speaking to this?
Sure. I think it's difficult to make predictions, certainly not quantitative predictions. I think think easy enough to say with students back, whether it's in our secondary education, whether it's in college. I think that interaction among students is likely to increase the rate of infection. Fortunately, we don't see a great deal of significant illness in school-age kids, university-age kids. My real concern is that person bringing that infection back into their home and to their parents, their grandparents, or to someone who has a condition that predisposes them to illness. So I think it's important to keep those things in mind. When you look at do your kids attend school? Do they attend a virtual school? What's the level of risk that a family is willing to assume? I think Dr. Mays spoke to this earlier. Every school, every university has put measures in place. CDC provides a set of guidelines and best practices for colleges and schools to follow, from limiting class sizes and requiring face masks, thorough sanitation of public spaces, encouraging social distancing. I think all of our schools and universities are trying to follow those guidelines and do their best to prevent spread amongst the students. I think important outside of the school setting to continue to think about avoiding large gatherings, parties of more than 10 people, and crowded indoor spaces where the virus is easily spread among folks. And then lastly, as I alluded to earlier, I think it's not something that's always front of mind, especially for college-age students, but flu shots are significantly important in this time for us. So I encourage those folks to get their flu shots as well.
Okay. Is the cheek swab test that was given at the free testing last week any less effective than the more invasive nasal swab? And if not, it seems like more people would get tested if they knew they could get the cheek test.
Dr. Reynolds, would you speak to that, please?
Yes, that's a good question. The limited data we have suggests that there's lower sensitivity in general for the oropharyngeal specimens, or the mouth and the back of the throat. The viral load just seems to be higher in secretions that are in what we call the nasopharynx, or the back of the nasal passages, back where it meets the top of the throat. However, the test they used at the community testing sites is called the Curative Assay. And according to the product information that they supply, it actually seems to have comparable sensitivity with the oral and the nasal samples. It's unclear whether other types of tests would have that same ability, or the same equal sensitivity. So I'm hoping that this is an area that will be continue to be studied.
Okay. Our numbers are getting lower every week. Are we over the danger of COVID?
Dr. Morrison, would you speak to that, please?
Yeah, thank you, Mayor. I am, like everyone else, happy to see our numbers flattening out and starting to decrease a little bit. But I would say we are clearly not past the danger of COVID. As the mayor alluded to earlier, with a positivity in our testing rate still above 10%, that indicates significant community circulation and some risk. The other number I like to follow is our daily new cases. Like the 10% number for testing positivity, new cases per 100,000, most authorities would also agree should be under 10 per 100,000 on a daily basis before we can really reopen confidently. And most would say, like the testing positivity, below 5 per 100,000. We've seen advanced economies in Europe reopening with new daily case rates below 2 per 100,000. They're still having some outbreaks and difficulties. So clearly the danger is less, but we're not past, and we need to continue to be vigilant.
Okay. How will parents be notified if there is a COVID case in their child's school?
Larry, the schools will notify parents if there's a positive case within their child's school.
Okay. Okay, this was a question kind of talked about earlier about the flu vaccine. When will this year's flu vaccine be available?
Dr. Reynolds, can you take that, please?
Yes. The flu vaccines are actually already available in some pharmacies in the community. And I do strongly urge everyone to get their flu vaccine. We've talked about this on a number of our calls, and it's very important for all of us to get vaccinated. However, I just checked the CDC's website and recommendation on timing of the flu shot. You know, some people are wondering, should I get my flu shot earlier this year because of COVID? And the CDC is still recommending typically getting your flu shot in September or October, not getting it early. They feel like getting it too early still will run some risk of lagging or diminishing immunity later in the season.
Okay. At least one of our larger area churches plans to hold in-person worship this coming Sunday. Under the governor's orders, churches operate under different rules. As health officials, what do you recommend?
Dr. Becker, do you mind taking a stab at this one?
Sure, thank you. We encourage communities of faith to follow CDC guidelines to prevent the spread of COVID-19, much like we do in our universities and schools. And that goes along with promoting healthy hygiene practices, hand washing, masking, intensify their cleaning and disinfection processes, being observant of ventilation, promote social distancing, take steps to minimize community sharing of worship materials and other items in our worship halls. We strongly encourage the at-risk population to watch or participate in services from home, to participate remotely. And as with any other activity in our community, if you don't feel well, stay home. Don't go to church. I think that's a key part of this as well. So I think that's great advice.
Okay. A lot of emphasis has been placed on face coverings to prevent the spread of the virus. How important are the surfaces we all come in contact with, like doorknobs, door handles, credit card machines, and pens we sign with, countertops and tablets and tables?
Dr. Morrison, it seems like there's been some change in the guidance on this over time. Can you speak to that?
Yeah, happy to. Thank you, Mayor. And while I don't want to minimize too much, we know that the possibility of the virus surviving in droplets on surfaces is definitely a real phenomenon, especially countertops, non-porous surfaces, doorknobs, certainly an example. We do feel like, though, evidence points to the fact that person-to-person transmission is much more important. Don't want you to be not conscious of surface, important to keep things clean as possible. But more importantly, frequent hand washing, especially after you've been out of your home or out of your typical area. Wash your hands frequently to minimize your risk from exposure to those surfaces. And then the other thing we know that helps is wearing a face covering will help prevent spreading those droplets to those surfaces in the first place. So wash your hands, wear a face covering.
Okay. 6 feet seems to be the minimum recommended social distance to keep from others, but there seems to be differing ideas on what is safe distancing outdoors versus indoors. Can anyone explain that, the difference?
Dr. Reynolds, can you answer that one, please?
Yes, certainly. You know, the CDC's guidelines on social distancing is actually the same for both indoor and outdoor. It's still 6 feet. Being outdoors seems safer because you've got better airflow, better ventilation, especially if you're standing, you know, upwind from somebody. It seems like it would be safer. But, you know, we just got to remember that when we're around someone, it's the droplets that we're expelling when we talk and breathe, and especially if someone is coughing and sneezing, that those droplets can still get into into our system and spread the infection even when we're outside. And in fact, when there's been some studies that area of infectious droplets can be even larger if you're exercising strenuously, so out jogging and that sort of thing. So we do recommend making sure that you're still keeping safe distance even when you're outside.
Okay. Have we turned over all local contact tracing to some other entity?
Not entirely, Larry. The Waco McLennan County Public Health District continues to investigate all priority 1 through 3 cases as those are defined by the CDC. And additionally, due to the continued disproportionate impact on the Hispanic population in Waco McLennan County, all cases that identify as Hispanic are investigated locally by our health district. Part of the investigation process includes contact tracing, which is the identification of direct contacts exposed to the case during the infectious period, so that they can be notified and quarantined appropriately. The identification of those direct contacts is done by the Waco McLennan County Public Health District, and then the notification is carried out by the Texas Department of State Health Services.
All right, very good. Well, let's stop our questions there, and let's go to our media questions. We have 2 representatives on the Zoom meeting this afternoon. We have Brooke Crum from the Waco Tribune Herald and Megan Vanslow from KWTX News 10. If Brooke Crum, if you will unmute, we're unmuting you now. And Brooke, if you have a question, would you mind presenting it, please?
Sure. Thanks, Larry. Good afternoon, everybody. And thank you for your answers about the schools. Just a follow-up, understandably, there will be some delay between when the test results come back and a suspected case on a school campus. How does that plan to be addressed?
Dr. Mays, I think that's a very good question, Brooke. Dr. Mays, do you have any input on that? And we may need to talk to the health district more about that.
Well, I think there's both components, and it's a great question because there will certainly be, and I believe most every school that we look at will have at least a 5-day period of shutdown when it's realized that there's a certain level of infection on a campus. And then, of course, all the quarantines that are associated with that. So that's kind of a first level of response, but it doesn't quite go to the depth that I think you're looking for. So I'll defer to my health department friends for that.
Dr. Reynolds, do you have anything to add to that at this point?
No, I would have suspected if a student has been tested, we're going to have to proceed if there's a significant concern about infection, to go ahead and proceed with quarantine and while we're waiting for that test.
Yeah, I think it's going to be a real challenge as schools reopen, because the testing that is going to need to be done is going to put a big strain on the labs, as we've seen in other situations where there's been a surge in testing. The labs have a hard time keeping up. And so we will need to discuss that further with our health authority and the health district to see if they have given protocols yet for that. If there are those, I'm not aware of them yet. If we find out anything more there, we'll let you know.
Okay, Megan Vanslow with KWTX News 10. Megan, are you there?
I'm here. Can you hear me?
Yes, I can. What's your question?
Okay, great. I actually only have a question for Mayor Deaver, and it's actually an unrelated city question. So if maybe I could come back at the end if you guys want to wrap up, if that's okay.
Sure, we'll talk after. Thank you.
Okay, Brooke, do you have another question?
Sure. Always happy to ask questions. So the mayor, you said the city is still enforcing the mask order. How has that compliance gone, with area businesses and such?
From what we've been told by Waco PD and what I've noticed when I've been out is just extremely good compliance. Occasionally you will see somebody that has their mask on, but it's pulled down below their nose, and that obviously is not an effective mask situation. But I think by and large, the compliance has been really, really good. I think it helps that President Trump has said down that you should wear a mask. I think there are enough things now that it's just so clear that it's helpful to avoid community spread by wearing a mask, that I think people have largely agreed to do it, even if they don't like it. And I think most of us don't like it, but I think we're getting good compliance there. Okay. Thank you for the question.
Thank you.
Megan, did you have another question you wanted to present at this time, or you would want anything else? All right. She may have already left the thing. Okay, let's move into our wrap-up time. Great questions, great answers. We're going to go in the order of Dr. Morrison, Dr. Becker, Dr. Reynolds, Dr. Mays, and then the mayor. So for wrap-up time, Dr. Jim Morrison with the Baylor Scott and White Medical Center.
Yeah, thank you, Larry. And again, thank you to our great partners, the city and county leadership, the public health district. Many thanks on behalf of the thousands of healthcare workers across our community and region. I'll also want to thank our media partners for keeping this at the top of the radar in our community. Very important. Like I said, glad to see things improving some, but with fall activities starting to happen, the time for vigilance is definitely not over.
Okay. Dr. Brian Becker with Ascension Providence.
Yeah, thank you. Thanks again for having me participate this afternoon. I do appreciate it. I'd echo Dr. Morrison's thanks to all those across our community who have been very supportive of the healthcare workers, those associates in both of our facilities across our community that provide healthcare. So thanks to our community. I want again to remind folks as we move back into school, it's a great time of year. Kids are looking forward to getting back to school, and it's part of our fabric. It is who we are, and it is important that we resume some normal level of activity, but we do it safely. I encourage again wearing of mask, hand hygiene, social distancing, flu shots. I think I can't overstate those things. And then in addition, we have Labor Day coming up in a couple of weeks. I think it's important for folks to remember limiting social gatherings is extremely important. I can't stress enough the number of clusters that we see in family groups. People oftentimes think it's safe to gather with just their family and not extended larger groups. But again, I think it's just really important for folks to not get complacent. We seem to have passed another surge, and it's easy to think it's behind us. It's important for us to be vigilant.
Okay. Dr. Kelly Reynolds from the Family Health Center.
All right. Again, as with Dr. Morrison and Dr. Becker, you want to thank this group for letting me join in this really valuable work. I think keeping our community informed with updated, accurate information is so vital at this time. When good information is critical and wrong information or bad information can be disastrous. And I also want to thank everyone out there that's listening, watching, and engaged with this discussion and conversation. I just encourage all of you to share what you've heard and what you've learned today. Try to get the right information going out there so that we can, help us keep all, healthy and safe as much as possible. I know there are folks out there that one of the things we've struggled at Family Health Center is, folks just not thinking this is that COVID is really something to worry about. But listening to Dr. Becker and Dr. Morrison talking about the increased volume of patients at the hospitals, knowing that that's going to increase further when flu season hits, because it always does. I really do worry about our community, having a bad flu season in addition to having COVID. So again, doing all the things that we've discussed here and following CDC guidelines, getting our flu shots, all very important. So thank you.
Thank you. Dr. Jerry Mays, Region 12 Education Service Center.
Well, thank you again for letting me be part of the conversation. And thank you all for keeping the conversation going, keeping the dialogue open, the sharing of ideas, the collaborative planning that we've seen over the last month since March have led us all to a much better place. And the reason we do this work on the education side, all of those children out there and their families. And as Dr. Becker said, it's part of our fabric. It's our society in terms of knowing what to expect from school and when children can and will be there and how they'll be educated and what those things look like exactly. So, in the schools, you see a lot of the face masks, distancing, sanitation, all even we were on a call with superintendents just this morning, and one was talking about first he was bragging on the children and how well they're complying with the face mask request. And I think that's so admirable. You know, children do what credible adults ask them to do almost every time. And that's what's happening out there in the schools. And they had even set up their hallways where the traffic patterns are one way. So there's lots of innovative thinking going on out there about how to create safety. Because the more we create safety, keeping them educated at a high level and getting better outcomes, sure, that's one of the first things we think about. But in this case, the first thing is, how can we do that while at the same time keeping everyone safe? You know, you ask in your first question about what's the common challenge out there. Well, that's it. It's keeping student outcomes, whether it's academic, social, whatever it is a child needs, balanced out appropriately with the need for safety in our community. So thank you to this group. Proud to be a Wacoan. Great work going forward. We'll all have to admit this is likely to be the most challenging school year that any of us have ever faced and in modern history. So we can expect lots of starts and stops. And as we do that, we'll all work together and we'll get through this together. So thank you very much.
Thank you. Waco Mayor Kyle Deaver.
Thank you, Jerry. Thank you, Larry. I want to thank Dr. Morrison and Dr. Becker for being here again on behalf of our hospital networks. We've said this before, but we're fortunate to have two really strong regional and in one case national networks here that help give us support here locally when we need them. Dr. Reynolds, thank you for joining us from Family Health Center. As Judge Felton has pointed out several times on these press conferences, we are truly blessed in Waco to have such an outstanding medical community, and really appreciate all three of you joining us to talk about the health aspects of this. Jerry, thank you very much for being on to talk about the school issues that's on everybody's mind and will be over the coming weeks, and really helpful to have your insight as you are in such constant contact with the superintendents and know what's going on at TEA and otherwise. I want to thank Larry, you and your team, and Julie Olvera with the City Secretary's Office, Kelly Crane at the Health District. Thank you all and your teams for all the great work that you continue to do to try to keep our community safe. And I also want to thank the media representatives who are on the line and those that sent in questions ahead of time, and our translators, because as Dr. Reynolds said, it's just so important that we get correct information out to our citizens so they can understand what they need to be doing, what they need to be worrying about, and what they don't need to be worrying about. We're going to have to continue as we call on all of us every week to be vigilant and work hard to prevent the spread of the virus. We are making progress, but as we have discussed, have a lot of challenges ahead of us. Please continue to keep our healthcare workers and first responders in your thoughts and prayers, as well as those that are currently fighting this disease and those who have succumbed to the coronavirus, as well as their families. I just ask that you continue to take care of yourself and take care of each other. We are making progress and we will get through this together. Thank you.
Mayor, thank you so much. You are so eloquent in speaking from the heart and speaking on behalf of the community. And I will echo what's already been said, that these press conferences are very vital to the community. I get input all the time. They get more out of our press conferences. They do a lot of the things. And I'm just thankful for you all being able to help present that. And I thank each of you, as one of the doctors mentioned, share this with people who don't have access to it. We will be replaying it again. It is available on our YouTube channel. It'll be out there probably in another hour, so people can watch it, and all the other press conferences are. This is all out there to help us do as we're doing. We're getting that control and hopefully going to get over this, and we're going to do it together. Thank you all for joining us, and have a good day.